Living with lupus in the Caribbean. So what is lupus? Lupus is an autoimmune condition whereby the body's natural defense mechanism attacks itself. The signs and symptoms can be many and very varied. It also takes some time to make the diagnosis, starting with hair loss, rash that tends to get worse in sunlight, joint pains, fatigue, weight loss, anemia, as well as things that we look for in the blood count. It can also affect internal organs such as your heart, lungs, kidneys. It is the prototype autoimmune condition. Let's talk about some of the challenges living in the Caribbean poses for a patient with lupus. As we are well aware, Caribbean, hot, sunny, although we enjoy it a lot, it can pose particular challenges for patients with lupus. Although the condition is not fully understood, we know sunlight tends to worsen symptoms. Sun protection is of the utmost importance. What do we mean by that? And what can we do to enjoy our sunny shows? All patients are advised to use sunblock as well as protective sun gear, not just on the face but all over the body. Even if you're indoors, daily use of sunblock and reapplying throughout the day help lessen flares and improve symptoms. Being in the sun, we tend to get dehydrated, which can worsen fatigue, so I always advise my patients to stay properly hydrated. So let's talk about anti-inflammatory diet tweaks that we can do here in the Caribbean. This is actually one of my favorite topics to discuss. You know, we love our carbohydrates in the Caribbean. It's part of our culture. We love flour, we love roti. Is actually a staple in our day-to-day meals. However, anti-inflammatory diet has been shown to have some proven benefits with some tweaks and tricks to lessen the effects of inflammation. So what I usually advise patients, if we can lessen, broadly speaking, flour, sugar, alcohol, swap for provisions. Higher protein foods such as tuna, eggs can be used, and also I usually advise a full consultation with a dietitian to have best outcomes and best diet that is tailored to your needs. For our lupus patients, regular follow-up is of the utmost importance. Why? It's always good to check in with your physician because there may be a change in symptoms. For instance, new rashes, new hair loss, new joint pain, fatigue, weight loss, which all need to be discussed. But I also advise there are things that you report and there are things that we look for. One of the things that we usually advise is regular blood tests. Things that we look for is a complete blood count. On this, we assess your blood count to make sure it's not low. In addition, your platelets to make sure that's also not low. And we also check your ESR or your inflammation levels. And that guides us in terms of how high and how active the lupus may be. Additionally, all patients should be getting a urinalysis done to assess that the lupus is not affecting the kidneys. The things that we look for is if there are any proteins or blood in the urine, and as such, treatment may need to be escalated and tailored accordingly. So you may be wondering, if I have lupus, when should I seek a physician? A generalized feeling of unwellness. Some patients describe it as a chronic flu, fatigue, you're not entirely well and you're not entirely sure why. Hair loss, rashes, unexplained, weight loss, fever. You may be even noticing swelling in the legs. The usual population affected by lupus are usually young females. So it's a condition that typically affects young women and is even worse in patients of Afro-Caribbean ethnicities. So if you're a young female experiencing any of these symptoms, definitely check a rheumatologist.